Okay. Hello and welcome to your Respiratory Part 2 lecture.
Hi.
And this is my daughter Lily. Hi.
Hi.
These are going to be covering medications for upper respiratory disorders from Chapter 8. So first we're going to come to antitussives. Well, this is going to be the opioid version of antitussives. This is going to include codeine and hydrocodone. This is usually not given directly, but usually in a cough syrup mixture. And so these are going to be used to suppress the cough by increasing the cough threshold by using the CNS effects of these opioids. This is going to be used for non-productive coughs in order to decrease that cough frequency and intensity. So increasing that threshold, they're only going to be triggered to cough in higher, more demanding circumstances. And again, remember, this is for non-productive coughs. So if they have a productive cough, this is probably not a good line of treatment for them because then they're not producing it out of their lungs and can stay there, get stuck, and become pneumonia and things like that. But as a result of being opioids, you do have these opioid type effects. So refresh here about your CNS effects, GI defects, and opioid use disorders. So next we have the antitussives that are non-opioids, so dextromorphan and diphenhydramine, which is Benadryl. These are going to suppress the cough through CNS action, but these can cause mild nausea, dizziness, and often sedation. And this is going to be especially more so when this is used in addition to any opioids. So Benadryl can cause sedation and that dizziness. So then we have your precautions about fall precautions. You have don't drive or operate heavy machinery. Usually take this when you're laying down at nighttime to decrease these effects, things like that. Expectorants such as guaifenesin, these are going to promote an increase in cough. So this is opposite. This is going to promote cough production by increasing and thinning out the mucus secretion so that that cough is more effective. But this can upset their stomach. So educating about taking with food. Can also cause drowsiness and dizziness. So don't take this again prior to activities requiring alertness. And then, of course, allergic reaction can occur, such as the presence of a rash. And in these cases, we need to educate them to stop this medication. As we are using this medication to thin out the secretions, that's pulling your water from other areas to your bronchial areas so that that mucus thins out, and because it's pulling that water away from other areas, we need to make sure that they don't get dehydrated. So educating to take with a full glass of water and stay hydrated throughout the day. If they do become dehydrated, they can develop that dry cough, and therefore that dry, irritating, non-productive cough is occurring, which is the opposite of what we want. We want effective coughing as a result of this medication. So not taking water with this medication can actually make the effect not as effective. That's something to think about. Mucolytics, such as acetylcysteine, hypertonic saline, these are going to thin and enhance the flow of secretions in the respiratory passages. So it'll kind of thin it out, make sure that everything is being able to be expelled. It's kind of like the next step up. But as it's getting very thin, and it can cause aspiration and bronchospasms. So watching for this to occur, and if it does, then we need to make sure that we stop the medication and alert the doctor. My guinea pig is having a ball right now behind me. That's the noise that you hear. This can also cause dizziness and drowsiness, hypotension and tachycardia. So monitoring for vital signs and changing their position slowly to decrease this effects and negative effects as a result of dizziness and hypotension. You know, if they stand up too fast, they could pass out. So avoiding activities that require alertness until they become accustomed to this medication. And then also hepatotoxicity can occur, so I'm watching those liver function tests, LFTs. Next, we have decongestants. So these are going to be phenylephrine, ephedrine, and pseudoephedrine. So Sudafed is the brand name. These are going to stimulate the alpha adrenergic receptors, causing reduction in the inflammation of the nasal membranes to treat allergic or non-allergic rhinitis, sinusitis, and the common cold. However, if this is stopped abruptly, they can result in rebound congestion. So the opposite of what we're wanting to take it for. So we need to make sure that they taper off of this slowly and discontinue with one nostril at a time. So if they were doing both nostrils or alternate nostrils, making sure that we're also using that in our taper regimen so that they are slowly coming off of it and not only irritating one nostril at the same time. And as a result of this, also recommending that they use this for no longer than 3 to 5 days. This is usually going to be an extra for no longer than 3 to 5 days, because if your body becomes accustomed to this, it can cause rebound congestion. Can also cause CNS stimulation. So the opposite of the opioid, so it's going to stimulate all of your systems, so they can be agitated, nervous, uneasiness. And if you begin to exhibit these symptoms, make sure you stop the medication and report to your doctor. And so these are the effects that are similar to amphetamine, which is why this is easily converted to amphetamine, and therefore over-the-counter purchases require an ID now. So think of amphetamines because it is an amphetamine. And then the last thing is vasoconstriction. This is one of the ways that it's helping reduce that inflammation, remember, but if it is in a client that is already having high blood pressure, cardiovascular disease, dysrhythmias, or coronary artery disease, that vasoconstriction can exacerbate their already history of problems. So avoiding in those clients for these types of decongestants. So next we come to antihistamines. So these are going to include diphenhydramine, which is Benadryl. So this is also an antihistamine. But additionally, for antihistamines, we have loratadine, which is Claritin, fexofenadine, cetirizine, and promethazine. These are going to block the histamine release in small blood vessels, capillaries, and nerves during an allergic reaction to relieve the itching, sneezing, and runny nose, the rhinorrhea symptoms, but does not relieve the congestion. So while it's doing this, it can also cause several other side effects to be aware of. So remember, with diphenhydramine, we have the sedation effect, but also this is also going to be true for promethazine. In efforts to reduce the sedation effect, we can educate about taking at nighttime, avoiding activities that require alertness, and avoid alcohol and other CNS depressants because this can worsen, of course, sedation. And then newborns are going to be very sensitive to this reaction, so being very careful about how much Benadryl and Phenergan they can give them. Next, we have the anticholinergic effects, so drying everything up, remember, so dry mouth, dry bowels, so taking sips of water, sucking on sugar-free candy, and maintaining a fluid intake of 2 to 3 liters. So with that dry mouth and constipation, they may also have urinary retention. So good bowel hygiene, good urinary hygiene, good fluid intake, and then making sure that with that dry mouth, they can relieve by these measures. Next, we come to GI discomfort, so nausea, vomiting, and constipation. And if this happens, then they can try to take it with meals to decrease those effects. Then we have acute toxicity, excitation, hallucinations, incoordination, and seizures. I've actually experienced this giving to a patient promethazine, which is Phenergan, can happen, seizures and hallucinations. This can be especially true in children, which is what I saw it in. And so watching out for a flushed face, a high fever, tachycardia, dry mouth, urinary retention, and pupil dilation. If this begins to happen, administering activated charcoal is going to be our intervention. It's not a reversal, but it is going to be an intervention in an effort to decrease the absorption of the rest of it if we gave it orally, which is usually the case in children. And then cathartic to decrease the absorption as well. Sometimes this can be given with the charcoal. We can give acetaminophen for any fever that they're exhibiting, and ice packs or sponge baths because this is a sudden high fever. This isn't gradual. And then lastly, respiratory depression and local tissue injury at the IV site. So again, with promethazine, I have not experienced this, but I have seen many pictures of the local tissue injury. So make sure that you look at your IV complications for identifying the different types of complications related to IV access and IV medication administration. This can also, in an effort to decrease the local tissue injury of promethazine through the IV, we prefer to give promethazine via IM. So IM is the preferred route, or through a large bore IV in very small concentrations, so very, very diluted. And then monitoring for that extravasation, again, refer to your IV complications PowerPoint. It will not be recorded. This is adopted from a previous lecture. It has lots of other slides, but make sure you look at the one slide that has all of your different complications for IVs so that you can see what this extravasation in your other ones look like. And then you can also have pain and burning at the site there. Monitoring for respiratory depression is going to be your interventions as the nurse after you're giving this through their IV, and have resuscitation equipment available, or at least know where it is. And then this is of course going to be contraindicated for clients that are younger than 2 years old. Nasal glucocorticoids is going to be the last grouping here in this section. So this is going to be fluticasone, which is Flonase, and then trimethaquinone and budesonide. These are going to decrease inflammation associated with allergic rhinitis. And this is usually the first line of treatment for nasal congestion, sinusitis, and allergic rhinitis. But it can lead to sore throat, nosebleeds, headaches, and burning in the nose. If this starts to happen, contact our doctor, but you need to rule out if it's an infection. If they're having a sore throat, are they developing an strep throat or some sort of infection? Make sure that you rule out this other complication, so related to immunosuppression. So your efforts there are going to be, washing your hands, staying out of large crowds if necessary, as applicable, I guess. Good cough hygiene, staying adequately hydrated, and things like that. And then last, because it is a glucocorticoid, you have your bone loss. So doing weight-bearing exercises and potentially taking a calcium and or vitamin D supplement. Big key education here for clients is that this can take up to 3 weeks to get desired effects. So gonna have to be in it for the long haul. And once you have past this period of time, then you can really determine, is this medication working for them or swapping to another one. Often Flonase is very commonly ordered or suggested, and you can buy this over the counter, but after 3 weeks, if you're still not having relief, then sometimes physicians will switch you to a different one. And this completes your lecture for Chapter 18 from your ATI textbook. Thank you.